You didn't do most of your training at Stanford, but you did decide to come to Stanford for your first faculty job. What attracted you here?
I had trained in advanced heart failure transplant cardiology, and I knew that I wanted to pursue a career in clinical research. And at my former institution, I was mainly doing clinical work. So I was really looking for an institution that was willing to support me in my research endeavors. And at that time, I didn't have grant funding. But in speaking to the division leadership at Stanford, they were incredibly supportive at giving me protected time up front to allow me to get my research off the ground, to apply for grants. So that was incredibly helpful and led to my successful receipt of a K Award, which I think really helped me launch my research career. I was also looking for a program that was really strong in heart failure transplant. And as you know, Stanford is one of the largest transplant programs in the country with a really rich history in heart transplantation. And so it was a very attractive institution for me from that perspective. And then also I was looking for mentorship.
Mm-hmm.
And when I first came here, Hannah Valentine, who was faculty at Stanford and Associate Dean of Diversity, became my mentor. And she was an incredible mentor for me, both career-wise and research-wise. And so I felt like everything really came together in terms of being able to start my research, being in a really clinically busy heart failure transplant program, and also having great mentorship. And so that's what brought me to Stanford.
Your research has really blossomed over the last few years. Tell us a little bit about what you're doing on the research side of things.
Sure. So most of my research focuses on heart transplantation, various aspects related to that. So I have an R01 award that is focused on how we evaluate and select donor hearts for transplant. We've done a 6-year prospective study and have enrolled almost 3,500 donors across the country, and are now analyzing the data. So this project's wrapping up, and we hope to develop models that can be used real time for donor heart selection. And then a lot of my work has also been focused on development of non-invasive markers of post-transplant complications. And so one of the assays that we've worked on a lot over the years is development and testing of a donor-derived cell-free DNA assay for rejection monitoring after transplant. And we've taken that from concept all the way to our clinical practice, where we now have a commercially available donor-derived cell-free DNA assay. So those are kind of some of the aspects of my research that I've been working on. And we participate in a lot of multi-center clinical trials in the heart transplant arena at Stanford. We have several investigator-initiated clinical trials in heart transplantation. So it's definitely busy, a lot of great research going on in this field.
Can we touch a little bit on the fertile ground of Stanford for transplant research? I know that, as you highlighted, it's a historic a program for many reasons, and we have leaders going back many years. Talk about the place that Stanford holds in that community.
Stanford is that it has a very rich history in heart transplant research. So the technique of heart transplantation was actually developed here at Stanford. The first heart transplant in the US was done here at Stanford. And for a lot of the early period in heart transplantation in the 1970s and 80s, a lot of the original developments in the field came out of our program. So the use of cyclosporin for immunosuppression, development of the endomyocardial biopsy, development of the first standardized grading scheme for heart biopsies, these all came out of Stanford. And then my mentor, Hannah Valentine, was one of the first people to really delineate the role of CMV infection in post-transplant complications and development of chronic rejection, or what we call cardiac allograft vasculopathy. And she's kind of recognized worldwide for expertise in risk factors and treatment of cardiac allograft vasculopathy. So I feel like Stanford's really led the way in heart transplant research over the years. And I'm proud to say that I believe we continue to do so. We have a lot of really interesting work in that field still going on here at Stanford.
Talk about your role as a mentor and your style and how that works, especially in relation to the fellows that you work with.
Kind of moving up the ladder, and as you said, going from being a mentee to finally being able to mentor kind of folks who are coming after me. And part of that I do through my role as a program director of the Advanced Heart Failure Transplant Cardiology Fellowship Program here. we have 3 fellows per year, and I've really enjoyed working with and helping to train these fellows. And over the years, kind of in my role as program director and then also my research role, I've taken on mentees. And so we've had some outstanding fellows who've wanted to pursue a career in heart failure who've started working with me. Right now, I have a mentee who's on a F32 fellowship award. I have another mentee who's on a T32 training grant. And so I'm really happy to say that we've had fellows who've been really successful in pursuing heart failure, both clinically and on the academic side. And we have a lot of resources for our fellows who want to do research, not only on working on some of the projects that I do, but we also have a very robust heart transplant database. We've got lots of data sets our fellows can work with. So I think there's a ton of research opportunities for fellows who are interested in heart failure here at Stanford.
You know, I think you've recently been promoted, and so talk a little bit about that. We know that there's a national underrepresentation of women at the associate and full professor level, and congratulations on your promotion. How has that been?
Thank you. So when I first came to Stanford, I think I was one of the first women appointed to the faculty in a long time. I think most of the female faculty in our division were full professors when I first came here as an instructor. But I'm glad to say that that's changed over the years. And so now we have a number of very talented women who are coming up through the ranks in our division, both at the instructor and assistant professor level. And so I think that we have made great strides in bringing in women to a field that has traditionally been very male dominated. And I think, the combination of mentorship, support for research, those have really made a huge difference. And I think that the division leadership has been incredibly supportive in helping us kind of pursue our career goals in whatever way that they can. And it's really nice to work in such a supportive environment here at Stanford.
What do you think is the vision for heart transplant at Stanford and in general, heart transplant overall?
So I think that, we are one of the largest heart transplant clinical programs in the country. And I think we kind of continue to push the boundaries with our clinical program. So we're doing about 70 heart transplants per year. And we take on a lot of high-risk cases. So we do a lot of multi-organ transplants, heart kidneys, heart livers, a lot of complex transplants in patients with congenital heart disease, patients who are highly sensitized. So I think we've kind of been really pushing the envelope in terms of kind of the patients who we're willing to take on. And certainly we accept a lot of patients who are who've been turned down for transplant at other centers. So that's kind of on the clinical side. Research-wise, we continue to participate in a lot of different research studies ranging from kind of NIH-funded multi-center trials to we have a whole pipeline of investigator-initiated studies that we're launching over here. And then I think the training program is really important. We are very lucky to have had amazing fellows over the years. As I said, many of whom have stayed on in our faculty. And for me, a huge priority is really training our fellows in advanced heart failure and making sure that they have the best experience possible and hopefully convincing more of our general fellows to go into heart failure.
Is there anything else that you wanted to add before we close?
Well, I'd like to say that we have added a rotation for our general fellows on the advanced heart failure service, and it's been a really popular rotation. And so the general fellows get to round with our team on our post-transplant patients, on our VAD patients. We're a big risk referral center for patients, who come in with cardiogenic shock. We have a very robust ECMO program, temporary mechanical support. So I think it's really great for our general fellows to be exposed to some of these patients, learn about taking care of these patients and kind of working them up for advanced therapies. And so that's been a really popular rotation, and now all of our fellows will be rotating on our service. So
the preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.